So we're here to get a better understanding of the role that medication plays in regards to our treatment. And I like to use the analogy of medication as a spotter. Once again, my name is Dr. Michael Anthony Murphy. I'm a double-boarded child and adolescent psychiatrist, certified personal trainer, corrective exercise specialist, and most importantly, a child of God. I specialize in empowering people to reach their God-given potential through improvements in mental, physical, and spiritual health. So before we begin talking about medication as a spotter, it goes like this. If you have a spotter, that means you also have a trainer. A trainer is the individual who is prescribing and providing the medications for you. It's important that you have a conversation with them about any changes or modifications you want to make when it comes to utilization of your spotter, and that y'all are clear-cut and understanding of where it is you're trying to go with your treatment. The relationship you have with your prescribing provider is the most important relationship when it comes to the management of your medication. So before you take any recommendations from anybody else, have that understanding. Brings up one thing I always like to warn people about, which is you should make sure that you have the time to express all of your concerns and get a clear understanding of your feeling and how you recognize your medication when you're meeting with your provider. Many times when people use fly-by-night services online, they may be there for 5 minutes, which generally is not enough time to express what it is you need to or get the understanding of how to move forward in the appropriate way. So make sure you have a good, healthy relationship with your trainer, the individuals who provide the medication, and don't make any changes until you've had a clear-cut understanding and documented conversation with them. Now, let's talk about 10 rules when it comes to how we see our medication as a spotter. Number 1, medication and the spotter does not take the weight. Just like we talked about, whenever medication is going to be implemented, it's typically going to be done with the understanding that medication goes along with modifications in regards to our lifestyle changes and other behaviors. Just like if you're treating diabetes, cholesterol, or obesity, whether you put a person on metformin, on anti-cholesterol medications, or GLP-1, it's typically going to be said, here's the medication, and these are the changes that you should implement in order to get better. Utilizing the spotters like that across the board, these are things that help with your depression. And now you need to go ahead and begin investing in the non-pharmaceutical techniques and skills necessary to truly make the improvements so that you can have a prolonged, appropriate response to your medication. Anything other than that is going to result in a suboptimal response, whether it be in intensity or frequency, which is this, or duration. And that's to say, a person is running into problems where either they don't get the full effects of the medication, they get a hit or miss response, or sometimes they get a rapid return to symptoms after a brief remission because they didn't implement the changes necessary to continue with the progress. Now, remember this, if you would have a spotter and the spotter puts his hands on the weight and you quit pushing, you're going to end up with the weight crashing down on you. You have to think of it the same way when it comes to your medication. You never want to think about it in terms of just modifying the medication, because the medication is the only thing that increases. If you don't increase those other efforts, then you're truly never going to get stronger to where you can handle your issues. Number 2, there are certain situations where the spotter carries more weight than others. Things such as psychosis, severe mood. In those cases, you may not want to think of it only as a spotter, but more like a Smith machine. You have to be locked in for a position of assistance at all times, maintaining compliance with your medication, and still trying to work on ways to improve the non-pharmaceutical ways of getting through your issues. Remember this, the medication does not make you stronger until you put in those efforts. So I want to encourage you to take your medication when necessary and continue to push and get stronger. Ultimately, it brings us to number 5, which is the goal is to be on as little medication as possible. And that goes with anything you do. You want to have just enough of any type of assistance to get where you want to go. You take what you need, but you give all you can. And with that mind state, you want to work towards improving the skills and techniques you need. As my dad says, if you give a man a fish he eats for a day, teach a man to fish he eats for a lifetime. You want to go about the same way when it comes to building up skills and techniques that are going to help you to be preventative from depression, anxiety, or any other issue that you're going through. You want to be able to restore yourself on a consistent basis by investing in skills and techniques that continue to allow you to feed yourself the nourishment from an emotional standpoint you need to grow into the person that you want to be. Now, sometimes just having the presence of the spotter can give people a sense of comfort. That can also become a trap for certain people, especially with the utilization of PRNs, benzodiazepines, anxiety medication. And I've been there, right? In regards to, I had times where I struggled with a set, called somebody to come over and help. Even though they didn't have to touch the bar, I was able to get it accomplished because they gave me a sense of security. However, you don't always want to have your sense of security tied up in medication that may not be there or available at your time of need. So be careful of running into a situation where all of a sudden you feel like you have to have that medication there for a sense of comfort. Make sure you speak with your provider if you've caught yourself holding on to benzodiazepines, things like Xanax, Ativans, or Clonopins, still stored up in the medicine cabinet. One, they can be dangerous for other individuals who may stumble upon them, but two, without those medications, you may be able to dig into and find the confidence that you need to move forward in regards to how you can handle your anxiety or other situations. Now, once again, have these conversations with your trainer. Make sure you and your doctor know on board what you need, what you have, so that y'all can best set up a plan to move forward and accomplish whatever it is you know that you want as your goals in treatment. Now, there will be times where you may need more assistance than others. Think about it in terms like this. I'm pushing as hard as I can, and all of a sudden, someone were to slap extra plates on the side. Even though I'm doing all I can, that new additional weight has now become overwhelming. And so I may need more assistance from the spot in those moments. Not a sign of weakness. It's a sign that sometimes the weight at which we're dealing is just a little more difficult to manage. And if you think about it in those terms, you also want to think about ways that you can shed some of those plates, right? What behaviors, activities, relationships, what am I engaged in that's adding more weight to what it is I need to push against or making my depression or my anxiety worse? I'll give you a hint. For a lot of people, it involves things like alcohol, substances, abusive relationships, or engagement in activities that cause them shame and guilt because in their heart, they know what they're doing is wrong. Remember, every habit ain't a sin, but many times sins can cause us to have some bad habits. So keep in mind, how can I relieve myself of any weight that's bearing me down, whether it be from a mental, physical, or spiritual standpoint? Now, within any case, you always want to avoid dependence. That's important, particularly when we're talking about medications for anxiety or stress. Medications that have the potential to be abused or for you to pick up a dependence or a tolerance to can be very tricky. They're called controlled substances for a reason, because they require a certain level of self-control. In addition, they require some outside controls. So make sure you're having conversations with your doctor if you find all of a sudden you feel like you need a little bit more assistance from the spotter than what was prescribed for you. And never make those decisions on your own. If you're taking your medication outside the confines of which it was prescribed for you, that's called misuse. And if you misuse medication enough, it can turn into abuse. And that can lead to dependency, and it can become a very vicious cycle. So only take your medication as prescribed, focus on as little as you can, and make sure you have a clear-cut relationship with your provider before you make any modifications or changes. All right? Now, a person can say, am I going to be on this medication forever? I can't tell you that. Your provider can't tell you that. The truth is, we can't just tell a person, oh, you're only going to be on this for this long. When you're dealing with mental illness or any type of psychiatric concern, it's not like taking a case of antibiotics where all of a sudden I can tell you in 10 days you'll be cured and you move forward. These are ongoing issues that you'll have. And so if you stick with the understanding of if I need assistance, I want as little assistance as possible as I continue to try to improve and increase to get better at dealing with my situations or stressors, then it allows you to have a freedom of understanding that medication may not always be necessary. And even if it is, if it's as little as possible and tolerating it, then allow that to just be an understanding of how you accomplish your goals. There's no shame in the utilization of medication. Only in psychiatric issues do you see this expressed. Many people don't feel guilty about maintaining on their diabetes medication or hypertension medication. Hey, I take cholesterol medication. Why? Well, I diet, I exercise, I try to stay in pretty good shape. However, I got genetic predispositions that say this is an ongoing issue. And so there's no shame in taking medication. Yet with the medication, I still try to be very cognizant of the health choices I make. So recognize that we're all on something for some type of reason. And there's no reason to feel any shame or guilt because the brain, just like any other organ, can have some issues or concerns. So the goal, though, is to be on medications until you're at the very least in the world of remission, a sustained remission. Typically 6 months, where if someone were to talk to you about what's going on with you, you really wouldn't meet criteria, or your symptoms would be so low, people would say there's not a level of impairment such that your function is of concern. And at that time, then you can have those conversations, but make sure you don't just say, hey, I'm going solo, it's been 6 months. No, have the conversations with your trainer. And last, a bad spot is not the same as a bad effort. And so if you can't tolerate a medication due to side effects, or you find that you're having a lack of a good response to the medication, speak with the provider. Always remind people, listen, I don't take it personal. I didn't make the medication, and neither did they. And so have those conversations. There are many times alternative medications and options that a person can choose. So it doesn't always have to be sort of a good against bad conversation. You can maybe look for ways to get better with less side effects or concerns, because sometimes the side effects can be worse than the symptoms that you're dealing with, or make those symptoms worse because they exacerbate some of the insecurities and concerns that can be related to what you're dealing with in the first place. So I want you to remember, medication is the spotter. And have the conversations with your trainer. Discuss any concerns that you have before making any changes upon recommendations that you hear. And with that, you'll find yourself pushing through all types of challenges and renewing your strength and continue to move forward. Hey, I want to encourage you to continue pushing forward. This is Dr. Michael Anthony Murphy. God bless. Peace.